Okay, so respiratory concept review. Remember, just like last class, I ask questions and you answer, right? So what is the, let's go back. Oh, wait.
We ready. Breathing.
Hold on.
It helps us breathe.
Okay. What is the function of the lungs?
Breathe.
So, yep, what is respiratory? What's the difference between respiratory and ventilation? Okay, so respiratory is a process in which exchange takes place between the atmosphere and the cell. Ventilation is the movement of air in and out of the body, right? So with the respirations, when we think about the cells, it's actually when the air is moving from the atmosphere in. So that, like when you think about dead space, that has to do with respiration. It comes into the nose. It's not really doing anything in the trachea. It's not doing anything. That is respiration, breathing in and out. Ventilation is when it actually penetrates into the cell and is getting so movement of the airway in and out of the airway, intermediate, replenishing the oxygen and removing the carbon dioxide. So removing carbon dioxide, oxygen and carbon dioxide exchange is a ventilation process. And the respiration is just moving the actual breathing in and out. Okay? So the notion of dead space, you know what that is, right? What else? So thoracic cavity, we have the pericardial space, the mediastinal space, right? So that's just knowledge, just knowing, okay, so it kind of helps us relate to every organ has its little sac, right? Every little sac has its little amount of fluid. And then if something goes wrong, then fluid from elsewhere can come and collect there, and then we have problems, right? And it needs to expand properly. So things can go wrong because of the whole anatomy of the lungs, right? So when we think of thoracic cavity, we think of the visceral, the parietal, we think of the right pulmonary, left pulmonary, like when we think about the whole structure, okay? All right, tell me a little bit about alveoli. Why is the alveoli so important? Gas exchange. What is the gas being exchanged? And carbon dioxide. Good. So of them, when we think about acidosis, right, or acid base, which one is most important, oxygen or carbon dioxide, right? And that one would affect which one?
It will make the pH go lower.
Exactly. Good. We'll get there. Again, okay. So another thing about alveoli to remember is the surfactant, right? That helps it stay lubricated in order for it to expand properly, right? So gas exchange occurs there. We also want to think about the fact that it has elasticity, and that's why it's able to expand and close on its own without any effort, right? And when we see the problems, we'll see sometimes it can't do it by itself. It can't close by itself, but it can open by itself. So that's not a good thing. So the elasticity in the alveoli is important to note. What else? What else can we talk about? Let's see. Okay, let's talk about the general, the diffusion, right? So factors affecting airflow. What could affect airflow? When we think about airflow, what can prevent the air from flowing in and out? Obstruction, like what?
Like a wart in your nose.
A foreign body.
A foreign body.
Broken nose.
Oh, a broken nose, okay. A tumor. A broken nose will stop the oxygen from going into your nose, but will it stop it from going into your trachea? I can open my mouth and I can breathe just fine. Right? A broken neck is more like it. Or, like she said, a foreign body, right? How about mucus plugs, right? Too much mucus. How about swelling, inflammation, right? If a person has anaphylaxis because of an allergy or something, right? That can, or swelling because of a burn.
A bird?
Right? Burn. Not a bird. A burn. Right? And we already mentioned or trauma, right? And or surgery. Okay? So anything that can cause an actual foreign object or swelling. Whatever causes the swelling, it can affect it. Okay, let's talk about some diagnostic tests. That's actually the first slide that was in my head. So when I didn't see it, I was like, wait, where am I? But Let's talk about the Mantoux test. What is that? For tuberculosis. And how do we do it?
It's a
little bit
into
of
the skin.
Uh-huh.
You check a couple days later.
Mhm.
Injury.
Yeah, so it's a little thing that they put, a little protein substance that they put under the skin. What is it supposed to do for you? Right. If it has a reaction, what does it tell us? We have TB or exposure, not the actual, because if it's not actual TB, what is it called? Latent, because you had some exposure or you had it before and it went away, that kind of thing, right? So what else can we say? Okay, so when do we check it? They give it to you, and then after how many? 2 to 3 days, right? Okay, so let's say it did raise to like 5 millimeters. What does that mean?
Positive if you have certain other conditions.
Right. If you are immunocompromised, it's not good. HIV, or especially, is not a good thing. But for people who are not immunocompromised or do not have other underlying conditions, what should it be? To say that you 10 millimeters. Yes, that's the test. Okay, what about sputum exam? What's that one? How do we do it?
In the morning.
Right. So
One has to be in the morning.
yes, in the morning, early in the morning. How is it performed? Like, what is the process? Yes, you want to hop too. Yes. But the thing is, you have to rinse the mouth first. And then you have to try to cough up, right? Because there's a difference between sputum and spit and saliva, right? So that's why you got to try to get it from deep within the lungs with a cough to make sure that you get a good sample, okay? And you definitely have to wash your mouth. How about thoracentesis? What's that one? Drainage? Where is it? Thoracic, so it's in the lungs. This is what we're studying. Now, but it's in a space, right? It's in a cavity. This person cannot shift positions like edema. They have to aspirate it out, right? And they have to be in a position like sitting up to have access. They have to like put like a little numbing something in order to stab the needle in and pull whatever they need to pull out. Okay. Okay. What about bronchoscopy? How do you perform that? A tube inserted down. So if it's a tube and it's a long tube, it has a little camera. What do they have to do first? Put you out. Informed consent. Awesome. Let's stay a little bit on informed consent. We'll get back to it at some point. But what does informed consent mean?
You are told
Patient
what the
understands the
procedure is happening.
Yep.
You're informed
Patient
of the
understands. You're
risks and
informed.
the
Yes.
benefits.
Okay. But who does that?
Doctor.
The doctor. So I just make sure that it was done by the doctor with the patient. I just make sure that I see it done. I witness that it's there. Okay.
Can you reinforce the teaching after the physician, like, say they explain it, then they leave, and they're like, oh wait, no, I haven't.
Well, if they ask, you have to say, I'm gonna go get the doctor. If they have any questions, like they can tell you, oh, the doctor said this. If you know it to be a fact, then you're like, yes, if that's what the doctor says, then that's what. But like you really can't kind of like express anything further than that's what the doctor said. Mm-hmm. Any questions? Anything? Get the doctor. All right, moving on. So now let's talk about COPD. Let's talk about, okay, so by definition, it's a group of chronic lung diseases. So we have pulmonary emphysema, pink puffer, and we have the chronic bronchitis, which is a blue puffer. Now, tell me about emphysema. Anything you know. And I want some answers over there too, not just here. Soon, I'm gonna have to be like, someone from here, someone from here, someone from here. So I wanna mix, come on now. Yes, who has barrel chest? That's emphysema, barrel chest, right? Good job. All right, what else about emphysema? Pursed lip breathing, yeah. But that's both of them. But yes, that's good too, that's good. Say it again? They're skinnier, yes, they're skinnier. And they are pink, yes, pink puffer. Another thing about the nature of their alveoli, the reason why it happened.
Permanently broken apart.
Right, the elasticity is gone, right? And it happens, let's see, it happens for different reasons because they're smoking, mostly because they're smoking, okay? It happens mostly because of that. Okay, so let's talk about manifestation. What would we see? We said the pink puffer, we said pursed lip breathing. What are other things? Barrel chest, what other things? Tripod position, yes. What else? Yes, we can see clubbing. The barrel chest, we can see wheezing, shortness of breath. So we can see that in both of them. Okay, what's the difference between the person with the bronchitis and the emphysema? What distinguishes them?
The elephant. Sorry, it's a picture. One is bigger.
One is bigger, yes. So the bronchitis, how do you know the person has bronchitis?
A lot of mucus.
That's the bigger difference, right? A lot of mucus, and because of the mucus, they have a lot more coughing. So the biggest distinguishing factor is like those people, it's like, I think if they're coughing for 3 months, more than 3 months, for a maximum of 2 years, then you know they have bronchitis. Okay, so that's like the difference between it's the coughing. They produce more mucus than the emphysema patients. Let's see what else. And then the difference is a little different because emphysema is smoking, just cigarette smoking. Whereas bronchitis could be because of chemical, because of irritation, it could be because of other things. Okay? And then they have similar manifestations. Now let's talk about nursing interventions. What will we do for either one of them? Because it doesn't really matter which one, right? The intervention is the same. Sit up, right? They usually don't like to lie flat, so they want to be at the edge of the bed. The tripod position is when they're over the table like this. What else? Yeah, physical therapy, right? If they can't cough it with the bronchitis, it's so much, it's so thick, they're so weak. So we want to do the chest PT to help move the secretion up so they can cough it. We could tell them half coughing to because they're so weak, so we kind of train them how to cough. The pursed lip breathing isn't another way. What does a pursed lip breathing do?
It expels CO2.
Yes, it expels it more. It gives them more control so they can breathe it out because it's trapped on the inside, right? Okay, what else? What about their acidosis state? Their acid, they're more acidic because the carbon dioxide is being trapped inside. So is it respiratory or metabolic acidosis? Respiratory, because it's a lung problem, right? And so that means the kidney is going to have to help them out. But we'll get to acid-base balance in a while. Okay, moving on. Let's look at pneumothorax. What is that? It is a collection of air or fluid in the pleural space. And it can come from outside chest wall or inside the lungs. And what that means is something from the outside can hit and cause the damage, or some tension on the inside, some stress can cause the little alveoli to burst, the blebs to burst. So that's why. Okay, so more on that. So it could be trauma, it could be surgery induced, pressure. Okay, what else? Okay, so the other notion too, and we mentioned that a little bit earlier, remember that atmosphere is that positive air or negative air on the outside of the lungs?
Positive.
It's positive, and the inside is negative. And the way to think about that, there's more air out here, plus more. And then there's a little small area in there, negative. So now, if somehow we break that, where there's either a hole or more, so much that it collapses, and so now there's going to be the positive air is kind of equal to the inside air, and then it doesn't expand because it's the dynamic between the pressure of all of this air pushing that's causing the expansion and relaxation. So once we lose that dynamic movement, we don't expand and retract anymore, right? Okay, so we talked about, so spontaneous is when it happens just like that. Tension is when there's something that, tension due to a buildup of pressure, right, results in the shift of major organs. Open is from trauma, like gunshot wound or stab, so it's literally an open wound, right? The one thing with that, they have what's called flail chest, and sometimes what happens is when you breathe in, it's supposed to expand, but it does the opposite. It retracts. And when you breathe out, it's supposed to flatten, but it does the opposite. So that's bad. That shouldn't be. Okay, what else? So we have now manifestations. What are we going to see? Say it again? Shortness of breath. Yeah, like what is another thing? If you're short of breath, what's going to be a problem? Like I can't breathe. I can't, like, what's that? Anxiety, right? So we're going to see anxiety. Okay, so now we're not breathing. What's the next step?
Oxygen saturation.
Yeah, the oxygen is going to drop. We're going to see that. The lung sounds are going to be off, for sure, yeah? But if a person's not breathing, so if you're breathing, you're flushed, right? Good looking, pallor, or, but better, worst case, cyanosis. Yes, so we might see cyanosis. Now, which organ is most connected to the lungs? The heart. So eventually, it might start causing what? Dysrhythmias. We can have, what's that thing called? Cor pulmonale, right? Where it's the lungs that's causing the heart to have some problem, okay? So what are some interventions? What are we going to do? Give oxygen, right? Chest tube. We got to get the air out, get the pus out. Whatever is taking up the space that's not allowing the lung to expand, we need to get it out. And we know, like, if it's a chest tube, if it's high up, that means it's air it's collecting. And if it's lower down, that means it's pus or fluid, right? Because fluid drop, air raises, that kind of thing. Okay? Tell me a little bit about chest tubes that we need to know.
Watch for bubbling.
Wash for bubbling. Yes. Bubbling means what to us? Huh?
A leak.
There's a leak, or
It's not sealed.
it doesn't necessarily mean it's bad. It could bubbling can mean that it's taking out the air from the space, right? So we have to always observe the patient first. If it's a leak, the patient won't be doing well, right? But if it's doing its job and it's natural bubbling, then our patient will be fine, right? Another thing, let's see, what else?
How much blood you're getting in the...
Yeah, so whatever we're collecting, how much is it? Is it too much? Is it too little? We need to measure it, for sure.
Take all the connections.
Yes. So that nothing comes undone. And always look at your patient rather than the machine first, right? And what else? Okay, moving on. Okay, here goes the drainage. Okay, so we have closed chest drainage. So we have, what is it doing? It's removing fluid or air, okay? Promotes re-expansion of the lungs. It prevents reflux of air fluid. So since it prevents a reflux, if it breaks, what do we do? How do we, yes, we get the tube that's connected to the person and put it into sterile water so it can do that same air suction type, no air go back. What if it comes out of the body? What do we do then?
Cover it.
We cover it, 3-sided occlusive dressing, right? Because we want air to go out if it needs to, but we don't want none to come back in. Okay, where is the water seal? And how can it be maintained? Where's the water seal? In the chamber, right? Let's see. What's another question? We talk about replacing, suctioning, water seal chamber, intermediate. Okay, checking for bubbles. Okay, bubbles can also mean, titling, another one. What's titling mean? Breathing, right? If there's no titling, there's no breathing. So that could mean what? If there's no breathing. It could mean that it's reinflated. It's time to take it out. Or it could mean that there's a problem, there's a kink, or something's wrong, right? Okay, what else? Let's see, anything else I missed? Okay, all right, let's move on. Okay, let's talk about infectious pulmonary disease. So what kind of infections are we talking about here? Tuberculosis, yes. So let's stay on tuberculosis for a minute. So we know tuberculosis, what kind of bacteria is it? It's gram positive. Is it gram? Wait, hold on. Now I'm confused. Hold on, wait. Did I write it down?
I didn't do well.
I think I wrote it down, but I don't see it here. I think it's a gram positive, but let me make sure. Now, negative gram positive. Now I forgot. I've always had gram positive in my head. But how do we identify it? We already talked about the MAN2 test. What's another thing that we have to do? Chest x-ray. So once we do the Mantoux test and it tells us it's positive, then we do a chest x-ray. If that's positive, then we do sputum. And that is really the key thing that tells us they have it. Once we see the little bacteria crawling around in that microscopic whatever, okay? What are the risk factors for getting it?
Oh, you live in Asia.
Not just Asia.
Or the outside country.
Different places, crowded conditions. Anywhere that there's a lot of population, people who are together. So in America, we have people who live in shelters or live in prisons or live in very tight communities where they like multiple people in one house, or schools, daycares, right? So anywhere there's too many crowds, we want to be mindful of that, right? Also, poor nutrition can cause a problem. What else? So close contact, immune system. If it's a decreased immune system, then we have a problem as well. If a person is has substance abuse, right? We have a problem there as well. Okay, so we do that. Treatment. What are the 3 medications? Rifampin, isoniazides, and ethambutol. Okay, and you have to remember how long to take them. I believe the least is 9 months, right? And the most important thing is you have to watch the person take them, right? So if you know that the person's not taking them, they have to come to a place where they watch you swallow it, because it could become a pandemic kind of thing. Okay, so what are we teaching them? What are we telling them? Yes, yeah. Right. So I think it's 6 to 12 months, because I'm looking at my notes here. 6 to 12 months I have. Drugs must be taken 6 to 12 months. They have to finish the whole complete thing. Okay. Let's see what else. Promote yearly checkup, clean hand hygiene. What about the mask? What kind? N95. Yeah. So that's the one specific disease process that necessitates us to have N95. Obviously, we know COVID also did that too, but tuberculosis was the first. Yes.
So how long you can't go to work?
How long can you not go to work for? I don't know. I think once you start the treatment, once you up to 6 months and you don't have any symptoms, but I don't quote me. I'm not sure. I'm not sure. You have to keep to see. You have to keep getting tested to see what the levels are in your body. But yeah, so we're gonna stop here, and I'll see you next week. We will finish this next week.
I'll